Hi, and welcome to the back page. I hope you've had a fantastic long weekend, especially because it's the last long weekend that we're going to have for a while, because the next long weekend isn't until the King's birthday, long weekend in October. That's right, we have a king for the first time in, well, most of our lifetimes. Moving on, I wanted to continue to talk about non-specific biomechanical neck pain. Now that's a bit of a mouthful. What it relates to is neck pain that's not highly specific. It doesn't generally have referrals into the arms. It's not associated with irritation to the nerves that produce a loss of power, loss of reflex, or loss of sensation, either in the head or the limbs. And it's biomechanical. So it's the result of a biomechanical overload. Could very often be the result of poor ergonomics, which is why we have such a focus on car ergonomics, workstation ergonomics at work and at home. But it could also be the result of just repetitive tasks or a poor setup that you have that means that you're doing something repetitively that loads your neck a little abnormally. If you have non-specific neck and back pain, it can be a good idea to come in and see us so that we can identify the segment. We talked in the last video about how a particular motion segment will often become overloaded. It will then become a little inflamed. The body will initially seek to sort of lock it down to prevent irritation. That may be because of local activation of muscles to prevent normal movement. It could be it could result in changing your range of motion in order to prevent irritating the joint, and of course the pain, because pain is a significant driver in a lot of these conditions. That brings us to revising the quick screen. Now the quick screen is something that I'd encourage our patients, especially our patients who we haven't perhaps seen for a while. And we have a lot of patients who just come in periodically. It might be once every 3 months, it might be every 6, even out to 2 years. We often get people that come in and say, look, I've been fantastic for the last couple of years, but things have just stirred up of late. A really good screen that you can do to prevent these things from getting to the point where you do have an acute syndrome and significant discomfort is just a quick screen. And a quick screen is something you can easily do. I would recommend trying to pick a schedule, so whether you do it once a week or once a month. You can also do it as required when you feel that your neck's starting to jam up a tiny bit. And it's pretty simple. The movements I would encourage you to do are lateral flexion, rotation, and then there's a combined, I call it KEMPS, okay? So first is lateral flexion, which is simply putting your ear on your shoulder. Now, don't overpressure, so don't push anymore, don't go overboard, just go to as far as you can normally go. That's called your active range of motion. And what we're looking for is pain, tightness, something you may experience creaking, crunching, grinding sensations, or even audible noises. If you have those, then it's probably a good idea to come in. I would suggest that if you have crepitus or joint popping on normal active range of motion, that really would suggest that you should come in and get us to have a look, because things are obviously not really happy there. The second movement is rotation. So rotating, looking over your shoulder, okay? So we have ear on the shoulder, both sides, and we have rotation, looking over your shoulder, both sides. The final one is the one that will put a lot of additional load on the joints of your neck. And that's a combination where we look up, we rotate, and then we flex to the same side. And you'll feel that loads the facet joints, which in the case of biomechanical neck pain, be it the facet joints or maybe even the uncovertebral joints, which I can talk about in other videos, it puts a lot of load on those joints, and if they're inflamed or irritated, they will very often let us know by providing what I'd call a noxious stimuli, which our brain then generally interprets as pain. It's important to remember that our brain spends its entire life locked in a box with no windows or doors. It forms its entire perspective of the world around us by receiving information. And it doesn't receive information in terms of this is hot, this is cold. It just receives signal in the terms of nerve action potentials. From all of this data, it puts together the picture that forms our consciousness. Now, as a result of that, people's experience of the world around them can be very different, and that's certainly very true when it comes to biomechanical neck and, of course, back pain. What one person finds excruciating and extremely limiting to their function, another person would just consider as normal background noise, which they don't actually notice. Hi, we've been getting some fantastic feedback to our videos, and I just wanted to take this opportunity to thank you. But also, I was going to help to ask you if you could like the post. Remember to subscribe, because that allows you to be notified when we make additional posts. Remember, subscribing is free, but more importantly, if you could remember to comment in the post and engage with other viewers, that's fantastic. It also, more importantly, allows me to tailor my content to suit you better and answer the questions you have. Something I did want to talk about now is stretching your neck. All of my patients would have heard me talk about my dislike and concern for the traditional ear to the shoulder overstretch style stretches, and there are many people who recommend these. The reason I don't like that is because there's a fair chance that if you're feeling compelled to stretch your neck, it's in response to a sensation of irritation or unease in your neck, which means that something's not quite right. Most likely a joint's inflamed or irritated. If you do this overload scenario, okay, what you are doing is loading that joint. So it doesn't really make sense to overload an already overloaded joint. Indeed, that approach is based on the idea that your neck symptoms are just purely being driven by neck muscle tightness, which in my opinion is seldom the case. A solution is to do what's called an isometric stretch, okay? So that is simply you put your arm up to the side of your head. Keep your posture up nice and straight. We'll be talking a lot more about posture in coming videos, because I really do think maintaining posture in normal day-to-day activities is something we don't place enough importance on. And all you need to do is push into your hand for about 8 seconds. Don't try to overpower yourself. Don't carry on like a 16-year-old boy and make it a contest of strength with yourself. You just need to push as hard as you can tolerate for about 8 seconds, and then relax. Don't overpower yourself. Don't start twisting and combining the movements. And don't try to actively crack your neck. That's not going to be a good outcome. So my suggestion would be to do that lateral flexion, so left and right. You can do that anywhere from 3 to 5 or even more times if you'd like, and you will feel a sense of relief because it backs off the tension, stretches those muscles out. It can even give a little bit of gapping and gentle movement to those joints, which will often provide relief from the sensations that are prompting you to stretch. You can also do that in rotation, similarly, okay, left and right, although my suggestion is just stick to lateral flexion, which is putting your ear on your shoulder. You can do rotation if you want to, but be very careful, because rotation moves the joints in a different plane and it's just easier to pinch and pull things. So there you have it. We've talked about non-specific biomechanical neck pain, which is a very common reason people come into the practice. And we've talked about the quick screen, okay, to recap, which you can do. It really depends on how often you want to do it. Some people may want to do it on a Monday morning when they get out of bed and just before they brush their teeth, or as they're brushing their teeth, or as they shave, what have you. Other people may choose to do it less frequently, like once a month. See if you need to come in, if you feel anything, or of course, do it when you feel that your neck is irritated and there's a need to do it. Flowing on from that, we've talked about the isometric stretch. Similarly to the Core 4, which I've put on YouTube and I've sent out, I'll be issuing that stretch and sending that out to everybody so that everybody's familiar with it. Between those two, I think that we can go a long way towards relieving people's neck pain and of course back pain, and help you on the road to optimal spinal health.